there is an extraordinary squeeze that's coming on the federal budget. And it's deriving from a whole variety of factors, including the fact that we spent up in going to the recession, and after you go through a recession, we're going to actually start spending down. For every $3 of spending the federal government does now, only $2 is covered by revenues. That's far, far from being sustainable. So there were a variety of efforts underway to try to cut back on the spending and more modest efforts to try to raise revenues. The same thing is playing out in a number of states. So this squeeze means that even relative to spending today, the share of our economy we spend on programs in general is going to go down. One of the real dilemmas here is that we sort of have our budget divided into categories. We have sort of this permanent, automatically growing part. We have this permanent part that doesn't really have automatic growth, and then we have what's often called the discretionary part. It means every year Congress has to, on a discretionary basis, appropriate it. A lot of the children's programs are not in that first part that's growing fast and automatically. They're in the second two parts, and even mainly in the third part, where every year you've got to fight to get the money under control. President Obama recently declared that he is going to try to freeze this last part. Not only freeze it in real terms, but actually to let it decline for 3 years in real terms. So a lot of the children's programs are in this part of the budget that's going to get squeezed. At the same time, the president is going to have some initiatives in the children's area. And so the question of how this balances out and how children's programs fare is going to be a tough one. I personally don't think that in the long run, I don't know about the next year or so, but I think in the long run, the children's budget is going to be extraordinarily squeezed unless we get a handle on this broader budgetary issue. And I think anybody who cares about children, and particularly investing in children, really has to be concerned.
I mean, one of the things that you and I have talked about a lot is that one of the ways of trying to get a handle on those big programs is thinking about the principles that could go through them that might help children and others. So, for example, we were just talking about how Medicaid is an important source of funding for children, even though that's not where most of it goes, but it's very important for kids. But that I think you and I would share the view, and I think lots of health experts would too, that the more our health spending can be about prevention, early intervention, developmentally appropriate care, and the less it's all about hospitalization and high-tech interventions, that's probably better both for children and for elderly people. And so some other research we're doing at the Institute looks at, for young kids, what kinds of choices could states or the federal government make about Medicaid that would get more money out there in ways that might prevent later problems. So there may be ways of addressing the squeeze that look at principles that cut across. And I guess when I think about the role that people who care about children should play in thinking about the overall squeeze, I actually don't think we're experts on many of the trade-offs, but there are a few that we have useful knowledge about. And one of the examples that I think about is at the state level, because states, of course, face trade-offs and squeezes, and they're doing 2/3 of the spending on children. And at the state level, states spend a lot of their money institutionalizing people, on prisons, on juvenile justice, in some states on mental health and mental retardation institutions. And though that costs a lot of money, you have staff round the clock. And the budget squeeze has led some states to listen to children's people who say, for example, big juvenile justice institutions are not only not cost effective, they're not a great idea. And so that to me is another example of where the people who know about kids have something to contribute not only to where we should spend, but to what principles we might use to become more effective in our spending.
If I could give an example of where the rubber hits the road and where it's really hard to make this differentiation, I've had at least one governor tell me that in past years, he basically had two big piles in his budget, and that was for Medicaid or health more generally and for education. There's a third pile of other things, but those were the two big items. And then every year he tried to allocate some amount of the additional revenues that he typically got from economic growth. He'd allocate it to the two piles. And he says now Medicaid is becoming so dominant that the education pile is being dwindled. And the education pile is clearly one where we're talking about really investing in kids. Now, I'm not saying we do educational spending well. I still personally think we don't do enough there, but there's a separate issue of how we allocate that money. The Medicaid pile Well, children, you think might get some of it, but in point of fact, as I say, they're not very expensive, so they're really, in terms of that growth, they're really getting very little of it. So if you actually look at those budgets more closely and you say, where's the additional money going? Very little of it's going to children.
I mean, we might disagree a bit about Medicaid in the states, because my sense is that that's really important spending. I mean, obviously, particularly in this recession, it's supporting low-income people, and particularly including, but as you say, not limited to kids and families. And so there, part of what I think matters goes back to what I was saying before about how big a partner the states are. And I think that the federal government spending more of the share, as it's done in the stimulus bill, so that states are not quite as much on the hook on the surplus, so that they're not creating cutbacks for kids and families in health care in order to do something else, is important. And that doesn't solve the long-run trade-off issue, but I would say that I don't generally think that. I mean, I think, and I think most states are understanding that cutbacks in health are not, at least in the middle of a recession when people are losing health insurance, the right way to go. But so there may be more. We may not agree on every single one of the trade-offs, but I think we both think that figuring out those priorities is important.
Definitely.